why several years ago we introduced the using of contrast-enhanced ultrasound for treating patients during HIFU. This is an example. This is a ultrasound image of a uterine fibroids enhanced by the contrast media, the SonoView, and this is the same patient after the treatment. This is totally different. The results, they may give us the idea of the effectiveness of treatment if we compare the results with the grayscale results where almost nothing seems to be happening. The advantage of using CHEUS during HIFU is that we have the instant feedback on the treatment efficacy. So by using ultrasound contrast medium during the treatment, we can be sure about the feedback and about the effect. So we can keep going to treat the patient until the results has been achieved. Another important issue is that the intravenous administration of contrast medium may enhance the ultrasound tissue impedance. It means that by increasing the impedance, we may increase the interaction between high-intensity focal ultrasound and the tissue, so we may increase the efficacy of tissue destruction. So we may use a lower power and a shorter treatment time in order to achieve the same results. There's an increasing evidence of the improved efficacy of high-intensity focal ultrasound with the usage of contrast medium. Some papers has been published over the years, and now I think it is something we cannot avoid to use during the treatment of our patient by using high-intensity focal ultrasound. This is another case coming from our experience. This is a patient with a colorectal cancer and a single liver mets in the left lobe. The lesion is big enough for affecting the structures within the liver hilum. That's the reason why the patient was refused to be resected, also because the N2. The patient was treated with the high-intensity focal ultrasound by using contrast-enhanced ultrasound medium. And the sanitation time was only 15 minutes. As you can see here, this is a patient lie down in prone position. This is a digital ultrasound view. The patient is breathing. You can see the liver going up and down. And as you can see, only the segment 2 is enhanced by contrast media. There's no enhancement in the segment 3. This is because it's been completely ablated by using contrast medium. This is the CT scan the day after. The segment 3 is completely not perfused, and this is 6 months later. The segment is being almost completely reabsorbed. Another case, very complex. The patient had a multinodular hypocellular carcinoma, biopsy proven. Many different local treatment has been done in this patient, who at the end of the story developed a huge lesion close to the hilum here. The patient in another hospital was treated with radio frequency ablation, but unfortunately the patient had relapse just around the necrotic area, as you can see here. And the boundary were pushing the inferior vena cava. As you can see here, the inferior vena cava is compressed. So the options for this patient were very few. We decided to treat the patient with high-intensity focal ultrasound. The patient was put in the machine in this position. As you can see here, there is the necrotic area where the tumor was completely ablated, and you can see the inferior vena cava with the contrast medium flowing in the lumen, and there's no tissue between the tumor ablated and the inferior vena cava. And this is the result the day after, 1 month, 6 months, and 2 years later. The tumor was completely ablated. Now, I would like to introduce the hot topic in a HIFU field in oncology, that is pancreatic cancer. Few information about pancreatic cancer, just to let you know how important is high-intensity focal ultrasound in this field. Pancreatic cancer has an extremely poor prognosis. It is the highest mortality rate among cancer. That's the reason why we call it a big killer. The prolonged survival can be only achieved by radical resection, but unfortunately more than 75% of patients are diagnosed with pancreatic cancer at the advanced stage. The postoperative survival in a patient resected is around 20 months. This is a medium rate, but the cost of this surgery is a morbidity of 30 to 43%, mortality rate between 1 and 5%, with a reoperation rate around 20%. So this is what we call the gold standard, or probably this is what we have until now. That's the reason why we think there's enough room for introducing high-intensity ultrasound in this field. Again, this review may give you the screenshot of what happened with those patients. The 5-year survival rate is 7% in patients not resectable and only 10% in patient resectable. So if we select patient according to resectability, you can see that the only 10-20% of patients may be resectable at the beginning, but the average of survival, the median survival rate is between 20 and 23 months. It is below 2 years. It is almost the same if the patients are locally advanced and unresectable, as you can see here. Why high-intensity ultrasound could be used safely in this patient? This is because compared with the other devices, the percutaneous devices, there's less complexity on the safety deployment of the energy, because when we need just to stick the needle percutaneously into the tumor, we are at risk to cause some vascular damage and bleeding. And another very important issue is that the energy, by using the percutaneous approach, is concentrated just around the applicators, with an heterogeneous distribution of the heat through the target lesion according to the environment. It is completely different when we are using high-intensity ultrasound, because the issue of the 3D conformal energy deposition. This is an example. This is a 63 years old man with pancreatic cancer. It is a stage 2. As you can see here, the tumor is affecting a branch of, this is a superior mesenteric artery here. The tumor is surrounding the artery. The treatment has been done just around the artery. As you can see, the artery is still there, and the tumor is being completely ablated. This is another example. This is a patient with a huge lesion at the head. This is the day of the treatment. You can see the spot, the white spot here. It is caused by the sonication. And this is the day after. You can see the tumor is almost completely ablated. We maintain a small tissue here just for avoiding any damage to the closed structures here. This is 1 month later. It is shrinking, still shrinking 1 year later. So those patients were all patients refused to be resected. And 1 year later, the patient is still alive with no tumor increasing the size. You can see here the white spot during sonication, and this is the boiling cavitation, destroying completely the tumor. If you look at the literature, around 4,000 patients with pancreatic cancer has been treated and reported in different papers. But if you look inside the series, the large majority of patients has been treated with the ultrasound-guided high-intensity ultrasound devices. And this is because we may use real-time guidance, so it means that we can see actually what happened during the sonication. So it is the inherent benefit of the ultrasound guidance. Then we are using the same form of energy for imaging and treating the patient. So it means that we can see what we can treat. Otherwise, we cannot deliver the energy. And we can compress the abdominal wall in order to have a dislocation of the bowel loops. They are just in front of the target. In this paper that's been published a couple of years ago, the authors made an overview of other papers published about the usage of high-intensity focal ultrasound with and without other treatment. And the data are really in favor to use high-intensity focal ultrasound in terms of that clinical benefit rate, and the total effective rate is much better if the other treatments are used together with HIFU than alone. Even pain relief is another important field where HIFU can help our patient. Majority of patients with pancreatic cancer in advanced stage may have back pain, and back pain may be palliated by using high-intensity focal ultrasound. You can see in this review that's been published 2 years ago, majority of the patients who received the high-intensity focal ultrasound had pain palliation with this no-invasive approach. And looking at this paper published in 2014, high-intensity focal ultrasound seems to be better than high-intensity focal ultrasound together with radiation therapy in terms of pain relief. And this is because, as we know, some patients may have some side effects after radiation therapy. However, in the same papers, the authors reported the immune factors data regarding the patient treated before and after ablation. As you can see, all patients in the post high-intensity focal ultrasound data has an increase of immunofactors. This is in favor of a sort of immunostimulation of coming with the treatment with high-intensity focal ultrasound. And we have some example of this field. This is a patient with primary pancreatic cancer located in the head, affecting the bile duct. This is the day after the treatment. You can see the necrotic area here, and the necrotic area 1 year later was almost completely reabsorbed. The patient didn't have any other chemotherapy after the 2 lines, so she only had high-intensity focal ultrasound. But look at what happened with the distant metastatic lymph node. This is the lymph node in the retroperitoneal space before we treated the primary tumor. And this is around 1 year later, without any other treatment, the distant lymph node, metastatic lymph node, almost disappeared.